Hey everyone, Dr. Dan here. Let's talk about one of the most misunderstood dental procedures, root canals. I know, just hearing the words can make people nervous. Everyone's heard a horror story or two, right? But here's the truth. Root canals today are nothing like they used to be. In fact, they're one of the best ways to save a tooth and relieve pain, not cause it. When a cavity gets deep enough to reach your tooth's nerve, or the nerve dies and leaves infection behind, it can cause some serious pain and swelling. Infection can also come from deep cracks, injuries, or even gum disease. A root canal is the treatment that removes this infected or damaged tissue. We carefully go in through the top of the tooth to access and remove infected or inflamed tissue, clean everything out, and seal it up to keep bacteria from coming back. The result, you get to keep your natural tooth and say goodbye to the pain. So how do you know if you might need a root canal? Common signs include pain when chewing, sensitivity to hot or cold, or swelling around a tooth. But sometimes there are no symptoms at all. Your dentist might spot the problem on an x-ray before you even feel it. That's why regular checkups are so important, to stop problems before they get worse. So how do you know if you might need a root canal? Common signs include pain when chewing, sensitivity to hot or cold, or swelling around a tooth. But sometimes there are no symptoms at all. Your dentist might spot the problem on an x-ray before you even feel it. That's why regular checkups are so important, to stop problems before they get worse. But if you do need a root canal, it will stop the infection, save your tooth, and prevent it from spreading. Root canals are much easier than most people think. First, we numb the area so you don't feel a thing. Then we make a small opening in the crown of the tooth to reach the infected tissue. Using special tools called files, we carefully remove the nerve and any bacteria, clean everything out, and then seal it up tight. At Temple Family Dentistry, we proudly use each file once, keeping it at full strength and reducing the risk of it breaking inside the tooth. It keeps your treatment as safe and effective as possible. After your root canal, it's normal to feel sore, but most people get right back to work or school, oftentimes the same day. Most post-op pain is typically an inflammatory response to the procedure, and NSAIDs like ibuprofen will help manage any discomfort. And once you've healed, your tooth will feel and function just like normal. Root canals not only stop pain and infection, they also help you maintain your natural bite and smile for years to come. So if you're ever in pain or think you might need a root canal, don't wait. If you have any questions or hesitations, we're here to help you guide you through each step of the process. Stay proactive about your oral health and let us help you stay safe, happy, and healthy. Thank you for watching.